let's talk about some basics of orthopedic assessment for massage therapists. So I have a question. How many of you massage therapists incorporate any kind of assessment into your initial intake process? Now I want to ask, how many of you massage therapists have time to incorporate an assessment into your initial intake process? Well, I want to talk about a few very basics of assessment that you can incorporate into your pre-assessment and your treatment, and then after treatment, post-assessment. So let's talk about it. Hi, my name is Ben, and I'm a massage therapist. And here we talk about all things massage and massage related. So if you're a massage therapist or just someone wanting to learn a little bit more about the massage therapy profession, I hope that you can find a little bit of value in some of these videos. If you do, hit the subscribe button. It lets me know that I'm on the right track. So as I mentioned before, how many of you out there incorporate any type of assessment into your work before you put somebody on your massage table? And why is this important? So the assessment can be very helpful in determining what types of tissues and structures are involved with the condition that your client is bringing in. So is the client coming in for just general relaxation, or they have a specific issue with their shoulder or their neck or their low back? Those are three common big issues that I see in my practice, and I'm sure that's probably common across the country. At a very minimum, it's probably best to have the client show you what movement creates pain. And that can, at a minimum, help us determine, is this something that is safe for us to work on? Do we need to refer out? Do we need to avoid this area when we're working on them during massage? You know, is it indicated or contraindicated? At a very minimum, we need to know that. So remember that massage is not necessarily going to cure what people are bringing into you, but it's just going to be another piece of that puzzle, a complement to other things that they're doing to help them on their wellness journey. But I do know massage can be helpful with some issues, but it's not going to be one or two treatments that's going to fix something. Something like that is very rare. And that's something that we talk to our clients about. Hey, if we want to work on this, we need to be consistent. Consistency is the key with anything, right? If we lift one weight, are we going to get bigger muscles? No, we have to consistently lift weights over time. So if we consistently get massage and body work done, the likelihood of results are going to be better than just a sporadic type treatment. So here's a very quick generalization to help you hone in on what tissues you may need to be working with. So if your client can move into or out of pain, so if you can move and make the sensation feel worse or make the sensation feel better, that points to the indication that it might be soft tissue related. If it doesn't matter where they move and it's always a constant ache or a sharp sensation, that points to an indication that it may be more nerve related. So that's a generalization to help you key in on some structures that may be helpful in your treatment. So it's not necessary to know all of the orthopedic tests and their names. So it's not necessary to know the empty can test or the Thomas test or any test like that. At a very minimum, we just need to know basic range of motion tests. How far can they move? Let's evaluate their movement. We can ask our client to just do some simple range of motion movements and to show us what movements hurt. So if we observe that they start to lift their arm and get to about 90 degrees and then their shoulder takes over, it's those little things that we look for that are going to help us put together a plan for our treatment. The things we're looking for are ease, range, and quality of motion. So we're looking to see how easy is it for them to move their arm? How far can they move their arm? And what's the quality of the motion? Is it choppy? Do they get to a certain point and start to struggle? It's all those little things we can look at that don't take very long as an assessment before we put them on the table. The more you ask for and observe range of motion movements with your clients, the better you're going to get at it. And the more that your clients are going to appreciate your work. That's why it's called a practice, right? The more we practice, the better we get at it. So we're not going to become experts at it tomorrow, but if we keep working on it, we keep getting better, and we find ways to educate ourselves. One of the ways that I'm helping to educate myself is I'm going through Orthopedic Assessment for Massage Therapists by Whitney Lowe. This goes through a lot of these specific tests and helps us hone in on what structures that may need to be looked at. But like I said, I'm keeping it pretty general today, and I'm just trying to get you to incorporate a little bit into your practice. So here's a great way to incorporate just a little bit. So we do the range of motion test before we get them on the table, and we make notes, how far can they move. After we get them off the table, we can do that same test. Show me your movement again. Now we want to ask them, what do they feel? And a lot of times they're either going to say, it feels better, it moves easier, or there's not much change. Most of the time, if you're getting into the structures and tissues that need to be, you're going to get one of the first two answers. Oh, that moves a lot easier, or that feels a lot better. Now, once again, we're not fixing things, but we're helping. And that's one of our big jobs as massage therapists, is to help promote positivity and hope in people. One of the biggest single factors of people getting better is the expectation that they're going to get better. So if they come in and say, oh yeah, my last massage therapist just said my shoulders were all messed up, I don't think there's anything you can do. So the worst thing that we can do is agree with that. Oh yeah, your shoulders are all messed up. You know, that puts them into what I call a prison sentence for having messed up shoulders. Anywhere they go, like, oh yeah, I just saw my massage therapist and my shoulders are all jacked up. So let's talk about an alternate way that we could address that situation. So someone's on the table and they mention, oh, my shoulders are all messed up, aren't they? Well, we don't need to agree with them. We don't need to lie to them and tell them there isn't anything going on, but just merely mention, you know, it's a temporary condition. We can work with it. It's not something that you may have to deal with forever. It's not a prison sentence. That's one of the terms that I like to use. We're not going to deal with this forever. That's why you're coming to see me. We can take care of this a little bit. It's not a permanent situation. And that's where you talk about the importance of regular massage work. You know, if we do want to take care of this, we should probably see you on a regular basis. And I'm going to suggest that we start out with a few visits more frequently at first. So I'm going to suggest 3 visits in a 2-week period. And then after that, we can reassess and see how you're doing. And then we can put together a plan. Maybe we need to see you once a month. Maybe we need to see you every 6 weeks. This is where you invite the customer to participate in their treatment plan. So what are we going to do on a consistent basis to help make sure we get you better or keep you better? And that's a great way to help educate clients and get them coming back in for regular massage work. So let's do a quick review of what we talked about. I'm inviting you to experiment more with range of motion movements in your practice. Just simple. The more we practice at it, the better we'll get. We also talked about providing that positivity and hope to people that we're seeing. We're not going to agree with any negative comments about their body. And we talked about some quick generalizations on how to hone in, whether it's soft tissue or nerve tissue. So I hope that you found some value in this video. If you did, I'd love it if you hit subscribe. That lets me know I'm on the right track. Even better, leave me some comments. Let me know what you liked, what you didn't like about this video. Let me know what you thought about my hair. I just got a cut yesterday. It's looking good, or where am I at? So as always, thanks for watching, and we'll see you in the future.